under the influence of nitrous oxide.
Nitrous oxide, commonly known as laughing gas or NOS, is a dissociative inhalant that produces a short burst of euphoria and relaxation. It's often inhaled from small canisters or balloons, but behind the brief high lies serious risk. NOS starves the brain and body of oxygen, and frequent use can cause nerve damage, brain injury, or even sudden death. When inhaled, nitrous oxide rapidly displaces oxygen in the brain, causing lightheadedness, confusion, and laughter. Repeated exposure damages brain cells and interferes with memory, focus, and mood. Over time, users may experience depression, anxiety, or long-term cognitive decline. In severe cases, oxygen deprivation can lead to seizures or unconsciousness. With less oxygen in the bloodstream, the heart must work harder to circulate what remains. This stress increases the risk of irregular heartbeat, fainting, and cardiac arrest. Repeated use can permanently weaken the cardiovascular system. NOS replaces oxygen in the lungs with nitrous oxide gas, making it difficult to breathe properly. This leads to coughing, shortness of breath, and, in extreme doses, respiratory failure. Long-term inhalation increases the risk of hypoxia, a dangerous lack of oxygen reaching the body's tissues. Reduced oxygen flow also affects the kidneys. Chronic hypoxia limits filtration efficiency and can lead to kidney damage over time. NOS interferes with vitamin B12, a nutrient vital for making red blood cells. Without enough B12, red blood cell production drops, leading to anemia and fatigue. Blood vessels also weaken, reducing oxygen delivery throughout the body. The depletion of B12 weakens the immune system, slowing recovery and leaving users more vulnerable to illness. This is where nitrous oxide is most destructive. It breaks down vitamin B12, which is essential for healthy nerves. As levels drop, users may experience numbness, tingling, or loss of coordination. Heavy users risk developing neuropathy, permanent nerve damage that can lead to paralysis. With less oxygen and nerve communication, muscle weakness and tremors are common. Over time, coordination and strength decline. NOS slows digestion and suppresses appetite. Combined with B12 deficiency, users often feel fatigued or nauseous. A long-term B12 deficiency also affects bone health, leading to weakness and increased fracture risk. Oxygen deprivation makes the skin appear pale or bluish, and prolonged use dulls complexion. NOS restricts circulation and oxygen to reproductive organs, lowering libido and fertility. In pregnancy, use increases the risk of miscarriage or developmental issues. Just one balloon deprives your brain of oxygen. Repeated use can cause permanent paralysis or death. Do you need help with your addiction? You don't have to face it alone. At UKAT, we provide confidential advice, expert treatment, and 24/7 support to help you take back control of your life. Call us today on 08081 633227 or visit www.ukat.co.uk. Recovery starts with one conversation.